Real news for Americans 50 plus. This is Emeritus News Channel.
And there are enormous logistical challenges to doing that. The production challenges of getting the vaccine out of the factories, the transportation challenges of getting it in controlled temperature vehicles, transported to warehouses, stored in warehouses, distributed along with needles, syringes, and other kits to about 90,000 locations throughout the United States. We know that each state is different. They'll have different strengths, different resources, different community resources that they can call on to help with vaccination. And we know also that misinformation spreads more rapidly even than the flu. So any rumor has the risk of creating concern, and we need to deal with that as it arises. In order to support states, localities, and territories and tribes for this vaccination program, the federal government is providing nearly $1.5 billion to help with vaccine planning and administration, is providing free vaccine, and we will have enough vaccine for everyone who wants to receive it. We won't have it as soon as we'd like, but we will eventually have enough vaccine for everyone. We're providing needles and all of the other equipment that's needed to vaccinate, technical support, and guidance. There's a real challenge here, and there was a choice to be made and a dilemma. We have some vaccine coming in early October. The bulk of the early vaccine will be in mid to late October. The choice was between having vaccine stack up in warehouses until we had enough to distribute substantial quantities everywhere, or getting it out as soon as it was available to us for distribution. And we think the only right answer, the only ethical answer there, is to get it out as rapidly as possible, particularly since we have flu spreading widely. What that means is that in the coming weeks, there's going to be some roughness. It's going to be a little bumpy, because in different states there'll be different levels of preparedness and readiness and planning. There will undoubtedly be places where people want to get vaccinated and can't in early to mid-October particularly, but that's a better option than just sitting on the vaccine. It doesn't all come out in one big drop. It comes out batch by batch from 5 different factories, and we felt that the only responsible thing to do was to get that out as rapidly as possible, knowing that that would mean that these first couple of weeks of October are going to be rough, a bit rough, in terms of there being a demand for vaccine that can't always be met. We do know that by mid to late October there will be lots of vaccine available, and that we'll be continuing to receive substantial amounts of vaccine every week for the rest of the year. We don't know what the uptake will be. In the past, it's been difficult to get people who clearly would benefit from vaccination to get vaccinated. And one of the challenges here is making sure that people who could benefit from it have every option of getting vaccinated, because doing so is the best way we have of reducing the amount of illness and death from influenza. We also don't know which states are going to have particular problems. We're working very intensively with states and localities to help them with preparations, to facilitate if there are administrative difficulties or logistical difficulties to help them overcome those. The bottom line is that vaccination is our best tool to prevent flu, that it's very likely to be highly effective this year against H1N1. We wish we had had it sooner, but we ensured that all of the steps were followed, and given the technology that exists today, this is as fast as it can be produced. It's particularly important for some groups. We know that there will be differences between different states in how ready and the approach that states take to vaccinate. Some states, for example, are planning very comprehensive school-located vaccine programs. Other states are planning less extensive school-located vaccination programs. This is an unprecedented effort, and though we wish we had a smoothly functioning system, that's not the easiest thing to have happen. This is not an ideal time to have had a pandemic. We have a public health system that has had decades of underfunding and neglect, and on top of that, the fiscal crisis has meant that there have been layoffs, furloughs, hiring freezes, difficulties getting purchases and contracts in place, and the healthcare system is not well set up to coordinate, to have information systems that work particularly effectively, or to prioritize prevention. And vaccination is really an ideal example of a preventive intervention. It's going to be a busy and challenging few weeks, but the good news is we have a vaccine. It's likely to be highly effective after a single dose for people aged 10 and up, and it's going to be rolling off the production lines, rolling into warehouses, and from there into doctors' offices, clinics, and health departments, and to school-located vaccine programs in the coming weeks. Thank you very much. And we can take a few questions. We'll start maybe in the room.
Hi, Mike Stobie from the AP. Doctor, you said that flu activity is trending down a little bit. Could you talk a little bit more about where it's trending down? And I have a follow-up question.
We've seen a couple of states, including Georgia, where we are here at the CDC, where we still have very high levels of flu, much higher than in an average flu season, but a little bit less high than last week. What does that mean? Well, it's not clear whether that trend will continue. It's not clear whether, if it does go down, it will come back up later. In New York City in the fall, where I was health commissioner, in New York City in the spring, where I was health commissioner, we had an initial wave, and then it went way down, and then it came back much stronger. So we are in uncharted territory. We have not had a flu season that's continued like this through the summer, or started this early in the fall since perhaps not since 1957, where there was somewhat of a similar pattern in the summer and fall. And what that means in terms of the future, only the future will tell. That's why we're monitoring so intensively on a weekly and even daily basis to see what happens with activity. But we're going to have to look day to day, week to week, and month to month for what those trends do in the future. Operator, do we have any questions on the phone?
At this time, if you'd like to ask a question, please press star 1 on your touch-tone phone. Please record your name, and I will announce your name when we're ready for your question. If your question has been answered, you may withdraw your request by pressing star 2. Once again, press star 1 if you have a question. And our first is from Miriam Falco from CNN. Your line is open.
Hi, thank you for taking questions. I have two. Number one, you addressed the fact that there won't be that much vaccine available at the beginning. What are you going to do when either people will really want the vaccine and you'll have too many people asking for it, or you may not have anybody show up because they're afraid of it or whatever? How are you helping health departments specifically in all the states to deal with this? Because you're saying there's not going to be a shortage of vaccine, but at the beginning there will be if there is high demand. Then I have a follow-up.
It's going to be primarily a question of communication at various levels. With the initial vaccine, much of it will be the LAIV, the flu spray, and that is unfortunately something that is recommended and indicated only for people who do not have underlying health conditions and are under the age of 50. So it's not for everybody, and that's a lot of what's going to be out first. There are certain groups that make a lot of sense to give it to first, such as healthcare workers or people who care for infants under the age of 6 who are otherwise healthy. The flu shot for H1N1 will be coming a little later, and the exact time of that we'll only know as we get closer. We ask people to be patient, to understand that we're getting out vaccine as quickly as possible, and to recognize that there will be times when it's not possible. Seasonal flu vaccine is available. They can both be given together, but people can be vaccinated now against the seasonal flu, and there's plenty of seasonal flu vaccine in most places.